Each summer, as the world seems to move further away from the shadow of the pandemic, an unwelcome guest makes its return. COVID-19. Despite masks being relegated to the back of closets, social distancing fading into distant memory, and interest in vaccines dwindling, the virus continues to rear its head during the warmest months of the year. For many, this recurring pattern raises questions about why the virus refuses to stay dormant and what it means for our collective health. But here's where it gets controversial. Are we simply accepting a new normal? Or are we failing to take the necessary steps to protect ourselves? This summer's resurgence is largely attributed to a subvariant dubbed stratus, which has proven adept at evading immunity gained from prior infections or vaccinations. Dr. Elizabeth Hudson, Regional Chief of Infectious Disease at Kaiser Permanente Southern California, explains that COVID-19 now exhibits a predictable pattern. 2 surges annually, one in late fall or early winter, and another during the summer. This trend suggests that summertime spikes may become a regular occurrence unless something changes. But why does summer seem to fuel these outbreaks? Several factors come into play, according to public health experts. First, increased travel and social gatherings provide ample opportunities for the virus to spread. People also tend to congregate indoors to escape the heat, where air conditioning might not always ensure proper ventilation, conditions that favor respiratory viruses. Additionally, immunity wanes over time, whether from vaccination or previous infections, leaving individuals more vulnerable. And let's not forget mutations. As the virus circulates, it evolves, sometimes acquiring enough genetic changes to outsmart existing defenses. When combined with other environmental factors, these mutations can lead to rapid transmission within communities. So, what do the numbers tell us? In California, the percentage of positive COVID tests rose sharply between mid-July and mid-August, from 5.69% to 11.59%. Officials warn that this upward trend will likely continue in the coming weeks, mirroring patterns seen in recent summers. Last year marked the largest summer surge since 2022, peaking in early August. Meanwhile, emergency room visits linked to COVID have also ticked up noticeably. For instance, among children under 11, 4.04% sought urgent care due to the virus by mid-August, compared to just 1.02% in late June. Similarly, ER visits for those aged 75 and older doubled over the same period. These statistics underscore how the virus remains a significant concern, even if it no longer dominates headlines. Yet, paradoxically, the urgency surrounding COVID appears to be fading. Fewer people are getting vaccinated, and masking has all but disappeared. While some view the virus as little more than a seasonal nuisance akin to the flu, others caution against complacency. After all, COVID can still cause severe illness, including debilitating symptoms like a razor-sharp sore throat and persistent cough. For the very young, elderly, and chronically ill, the stakes are even higher, with hospitalizations and deaths still occurring. The U.S. Centers for Disease Control and Prevention, CDC, estimates that at least 38,000 people have died from COVID-19 since October 1st, surpassing the estimated 27,000 flu-related deaths during the same timeframe. Compounding the issue is the lingering threat of long COVID, which affects millions nationwide. Data suggest that at least 17 million adults and 1 million children had experienced prolonged symptoms after infection, with 1 in 5 adult sufferers reporting substantial limitations in daily activities. Other respiratory illnesses, such as influenza and RSV, pose additional risks, particularly for vulnerable populations like infants, seniors, and those with pre-existing conditions. Vaccination rates offer another sobering perspective. Less than 15% of Californians have received the latest COVID vaccine formula, introduced nearly a year ago. Among seniors aged 65 and above, uptake is slightly better at 37.2%, but drops significantly for younger demographics. Geographically, areas like the San Francisco Bay Area show higher vaccination coverage, with nearly 25% of residents inoculated. Conversely, counties including Los Angeles, San Diego, and Orange lag behind, with only 12.5% of their populations receiving the updated shot. Public health officials continue urging everyone 6 months and older to stay current on their vaccinations, emphasizing the importance for high-risk groups. However, recent shifts in federal policy have sparked debate. Under the leadership of Robert F. Kennedy Jr., appointed to head the Department of Health and Human Services, the CDC has adopted a hands-off approach regarding vaccination recommendations for healthy pregnant women and children. Instead, parents are advised to consult healthcare providers before deciding on vaccinating their kids. Mainstream medical organizations like the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics maintain that vaccination remains critical, especially for pregnant individuals and young children. Some physicians, like Dr. Peter Chin Hong, advocate for immediate vaccination for those at risk, arguing that waiting for next season's formula isn't worth the gamble. Looking ahead, wastewater surveillance indicates that this summer's outbreak is less severe than last year's. Levels of the virus detected in sewage samples across California are roughly 20% lower than the peak of the 2023 wave, and half of what they were at the height of the 2024 surge. Hospitalization and death rates are also comparatively low, offering a glimmer of hope. Still, there's no room for complacency. To safeguard yourself and others, consider taking proactive measures. If you're overdue for a vaccine, especially if you're in a high-risk category, now is the time to act. Should you contract the virus, seek treatment options like Paxlovid, which can shorten the duration of illness and alleviate symptoms. Avoid close contact with sick individuals, and don't hesitate to wear a well-fitted mask in crowded indoor spaces. Improving indoor air quality by opening windows or using air purifiers can also make a difference. Lastly, stay vigilant about testing if you develop symptoms or suspect exposure. And this is the part most people miss. Protecting yourself extends beyond COVID. Make sure you're up to date on your flu shot and consider the RSV vaccine if you're eligible. Pregnant women should prioritize both the flu and RSV vaccines to shield themselves and their newborns. With so much information and misinformation circulating, it's crucial to rely on trusted sources and engage in open dialogue. What steps are you taking to stay safe? Do you think we're doing enough as a society to combat these recurring threats? Share your thoughts in the comments below.